of focused antenatal care. That is what we are going to discuss today. And I'm happy that you have joined, and do subscribe to this particular channel for more videos that we will post. And if you have not watched my previous videos on antenatal care, we are still continuing this particular booklet, and I'm welcoming you all, and I would like you people to continue viewing this channel and like this channel, because you matter a lot to us, you matter a lot to us. We respect you a lot, and we want you to continue discussing with us. We had talked about further support in terms of focused antenatal care, that is season 1, and also we had talked about uh, antenatal profile, antenatal profile, that was season 2, and also we talked about preventive services in antenatal care. Now, today we want to jump to danger signs during pregnancy, and this is very, very important, and I want you people to pay keen attention and keen interest in this particular topic, because we want to help these our mothers. We want them to deliver well. We want them to we do not want them to develop any complication that might arise in terms of uh, delivery. So welcome to the person who has joined us, and we are discussing about danger signs during pregnancy, and this is Focus Antenatal Care, Season 4. Kindly share the video so that people should join us as we continue. Now, before even we touch the danger signs, before danger signs, we should be able to take care of this pregnancy, and care during pregnancy is very, very important, because it will help the mother to nurture the growth and development of this channel. Yes, Gamer, my friend from India, welcome to the channel. So danger signs, so care during pregnancy, we want this particular pregnant woman to eat one extra meal every day during pregnancy. We are still continuing discussing about this particular booklet. Kindly eat one extra meal during pregnancy. You will not be able to follow the normal schedule or protocol whereby families normally eat breakfast, supper, breakfast, lunch, and supper, but you may eat an extra meal to make you feel strong. Of course, you required to eat plenty of fruits and vegetables, and as you can know very well that plenty fruits and vegetable, we want these micronutrients and minerals to help in growth and development. We need this phosphorus, we need the calciums, we need the folic acid, and we need vitamins, the vitamin A, B, C, and vitamin E. These are very, very important in nurturing growth and development of this particular child. And the only way you can get all these nutrients by eating fruits and vegetables, particularly green vegetables and fresh fruits. And we encourage you to drink plenty of water, at least 8 glasses in a day, at least 8 glasses in a day, and this one will help in this growth and development. We talked about the importance of iron and folic acid in our last season, and if you have not watched our last season, that is the discussion we did some 2 days ago about importance of micronutrients that we normally give during antenatal clinic in terms of preventive services, we said that folic acid and iron, we give them to help build the blood level of pregnant mother. Also, we talked about folic acid, that folate normally provide a micronutrient that is preventing neural tube defects, and we talked about one of example, that is spina bifida. We also said that folic acid is very, very important in helping the cell growth and preventing interference with DNA, which can even cause cancer growth. And avoid heavy work, rest more. In many cases, we normally find that pregnant women come to the hospital with what we call premature rupture of membrane, because maybe they have done a lot of work. There are very many causes of premature rupture of membrane or preterm rupture of membrane that we are going to discuss. Work normally helps your body to build your strength, so that when you are developing labor, when the labor process will come, you'll be able to push and be well in terms of this particular pregnancy. Now, as we continue, we said that avoid heavy work and rest more. Bed rest is very, very important, and this one will help us to nurture this particular child. Also, sleep on long-lasting insecticide treated nets. This one we had discussed about preventive services, and our main aim is to prevent the mother from contracting malaria, and go for antenatal care as soon as possible, but at least 4 times during pregnancy. At least 4 times during pregnancy. There's a reason why we said 4 times during pregnancy. Remember, in our last discussion, we said that all preventive services, mostly the tablets and the injections, the folic acid I've talked about, ferrous sulfate I've talked about, deworming we talked about, and the malarial antimalarials that we normally give, SP, we normally start giving them at 16 weeks. And we would love our mothers to start antenatal care at least 4 times, beginning at 16 weeks of gestation. So if you have not watched those episode 1 of father support is also very, very important, because we want our fathers to be involved in taking care of our mothers when they are pregnant, in terms of taking care of the pregnancy. Now, and again, antenatal care in terms of antenatal profile and preventive services are very, very important, and this one also help in care during pregnancy. Now, pregnancy is well embraced well in many of the societies, and those who have planned to get pregnant and they will carry the pregnancy to term. And I'm very, very happy that most people have been responding well to my episode 1 and episode 2, episode 3. Now I'm doing live in episode 4 of care during pregnancy, and also danger signs that we are expecting in this particular pregnancy. Now, there are signs that I'm going to read here in relation to this book, and we are going to discuss them one by one. Now, a pregnant mother should take a step of faith and visit a nearest hospital and visit nearest healthcare provider when she experienced the following: severe headache. We are going to discuss this one by one. Vaginal bleeding, severe abdominal pain, reduced or no movement of unborn child, that is no movement of fetus, convulsions or even fits, fever, and when she feels weak in terms of becoming pale, when she has noticed breaking of water, that is rupture of membrane, when she sees the amniotic fluids, and getting tired easily, and swelling of the face and hands when she feels breathlessness, and should be prepared, as I've said earlier, to seek skilled care in case of the above signs and symptoms that I've read. Now, severe headache, as you have been following this my discussion, I've talked about conditions that might result into headache. Normal body processes normally respond to anything that interferes with the body, and one of it is the body response is fever and headache and even general body tiredness. In relation to this topic, severe headache can be a sign of malaria, can be a sign of diabetes in pregnancy. There are common conditions that can also cause headache, but in this scenario, we are referring to common condition that can interfere with growth and development of the fetus, and even can result into interference with the maternal well-being or maternal death. Now, preeclampsia I've mentioned earlier, and eclampsia I've mentioned earlier, and this one we normally investigate, and we tie your blood pressure with laboratory investigation in terms of proteinuria, proteins in urine. And also we correlate with signs and symptoms like puffy face, that is swelling on the face, and even swelling of the lower limb. So it's very, very important that if you report this, if you report severe headache, we'll investigate in terms of checking your blood pressure, in terms of checking your urine, and also general history of the way you are presenting. And also we've said malaria, of course, we'll do blood slide for malaria parasites to rule out malaria, and also we'll make sure that we do blood sugar to um, to rule out gestational diabetes or diabetes in pregnancy. Vaginal bleeding is also another very, very danger sign that we should be taking care of in terms of during pregnancy. When a woman develops bleeding during pregnancy, it's not well uh, in terms of this particular pregnancy. I discussed one of bleeding during pregnancy is normal, that is implantation bleeding. Implantation bleeding, kindly in my channel watch about implantation bleeding. I've also talked about blighted ovum, which can be bleeding. Pregnancy is positive around when the pregnancy is still early, and that one also is a very, very important video that you should go and watch so that you can understand about blighted ovum and implantation bleeding. Now, we are talking about antepartum hemorrhage, that is APH. What can be causing this APH? Mostly placental issues to do with the placenta, majorly when the placenta is low-lying or the placenta has detached itself from the endometrium. When placenta is low-lying, that is called placenta previa, and this one poses danger in terms of the fetus and the mother. Even placenta abruptio, when placenta detaches itself from the endometrium, and this one can cause severe bleeding that may result into severe anemia. As you know now, getting blood is very, very difficult for transfusion, particularly those who are having blood group of negative, O negative, A negative, B negative. It's very, very difficult. So I would urge us to come to the facility if you noticed any slight bleeding, so that we may verify, is it placenta previa, is it placenta abruptio, is it vasa previa, which involves the fetal blood, or is it called what we call cervical entropion. And of course, we also rule out other infection by doing what we call urinalysis. In this urinalysis, we can even rule eclampsia and preeclampsia that we've talked about. And in urinalysis, we can rule urinary tract infection. I had talked about urinary tract infection in full plus management. And in terms of this infection affecting the pelvis, I've also talked about bacterial vaginosis. I've also talked about vaginal candidiasis in details in my previous videos. So therefore, watch my videos about vaginal smell, causes of vaginal smell, and different types of vaginal smell, and how we can manage them. And also watch urinary tract infections. And this one, you will really understand that UTI, vaginal candidiasis, even pelvic inflammatory diseases can also result in bleeding during pregnancy. We don't forget about ectopic pregnancy when implantation takes place in the fallopian tube or even intra-abdominal, that is abdominal pregnancy, can also result into this. So ectopic pregnancy is very, very important when implantation has taken place in fallopian tube and it has ruptured, and this one may pose danger in terms of uh, fetus and the mother. So vaginal bleeding is a very number two danger sign that if you notice, even if you are spotting, you should come to the facility so that we rule out whether it is premature rupture of membrane or preterm rupture of membrane. So there are very many investigations that we are going to do to you, and we are going to, of course, when you are develop a pH, that is antepartum hemorrhage, will admit you. We'll even do full blood count or complete blood count, that we verify your level of blood or hemoglobin level. If it is less than 5, we'll recommend transfusion. If it is less than 6 in pregnancy, we'll recommend transfusion. And also after the post transfusion, depending on the level of your hemoglobin level, we can decide to give you 1 pint of blood or 2 pints of blood or 3 pints of blood. And also we rule out other hematological disorders that can lead to bleeding in pregnancy by doing this full blood count. So it is very, very important. After transfusion, we may continue with folic acid and ferrous sulfate as normal, and some can also give you syrups of multivitamins and encourage fruits intake so that we help you build this your hemoglobin level, so that when during delivery you get easier time, and this may prevent another severe anemia. Now, another problem or another danger sign in pregnancy is what we call severe abdominal pain. Severe abdominal pain. And if we mention severe abdominal pain, we are referring now to the pelvic organ, the reproductive system, the internal, even the external reproductive system of a female, whereby we are going to think anatomically where is this pelvic pain. Lady Beavers topic that we are discussing now. We are thinking anatomically, where is this bleeding? Is it from the uterus? Is it from the cervix? Is it from where is this pain? I mean, is it from the uterus? Is it from the fallopian tubes, originating from the ovary towards the fallopian tubes? Is it from the vaginal area or the cervical area? So when there is severe abdominal pain, it can be associated with, is my volume well? Just comment. Am I is my volume okay? Okay. Now we may start by investigating why you are developing severe abdominal pain. Urinary tract infections, disease. If my volume is good, is well. pelvic inflammatory disease. This can result into severe abdominal pain. Even ectopic pregnancy, ruptured ectopic pregnancy can result into severe abdominal pain. Also, problems on the uterus like endometriosis or uterine fibroids with pregnancies can make a woman to feel the severe abdominal pain. If it is associated with fever, we might think of now an infection. Of course, what we'll do is we'll correlate with your signs and symptoms, the way you are presenting, and investigate accordingly. Of course, we'll send this particular mother to do what we call pelvic scanning or the so-called ultrasound. Ultrasound will be able to give us the fetal heart rate, whether fetus is well, will give us the extent of placenta, whether placenta is low-lying, case of placenta previa, or placenta as detached. It can be severe abdominal pain associated with bleeding and also fever. So ultrasound will tell us whether where the problem is arising, and with doing this it will also help us to know what step to make after getting a diagnosis from the scan. So severe abdominal pain is very, very key in terms of danger sign during pregnancy. Do not, the problem with our mothers is that they normally assume. Of course, we know that there's what we call Braxton Hicks false labor, false labor that comes and goes within some few minutes. But labor is normally continuous, and you will realize that it is happening towards term pregnant, 37 completed weeks. So do not misjudge uh, Braxton Hicks with any form of labor. Kindly come to the hospital if you feel severe abdominal pain so that we investigate and find out what is happening to this particular mother. Now, reduced or no movement of unborn baby. This is now a normal layman's language. When there is no fetal kicks, a mother comes to the hospital, particularly from 20 weeks of gestation. Those who have delivered twice, three, ACO TV, welcome. Thank you so much for joining. I'm talking about danger signs during pregnancy, and I've mentioned about severe headache, I've mentioned about vaginal bleeding, I've mentioned about severe abdominal pain, and now I'm tackling reduced or no movement of fetus at all. Now, when do we feel fetus moving? Those who have delivered multiparous, those who have delivered twice, third, fourth times, they would normally know. But for preemies, they after 20 weeks of gestation, preemies may not feel, but those who have delivered, they might start feeling from 20 weeks of gestation. And if you have started feeling that there is no movement of fetus, there's no fetal kicks. In fact, gynecologists normally say that there is no specific number of movements that is a rule of thumb that you may experience when a baby is moving or when a baby has not moved at all. But 10 movement in an hour is very, very important. And if you feel that now the movement has reduced, then you should be able to start thinking of seeing your clinician, thinking of seeing your gynecologist, thinking of seeing a nurse, so that we may find an investigation, because there are fetal factors that might affect the fetus to die intra-utero. And there are also maternal factors that may affect the mother. If we start with maternal factors that are known, maybe I may refer this as Lowland. They normally like TBA, and there is a concoction that they are given when they they experience lower abdominal pain, the so-called rariu, rariu, let me say like rariu, that is our local dialect. Now, when they feel this particular pain, they are given some concoction, and some do take excess. And when they do take excess, they come with no movement at all. If we do our, if we start with the normal fetal scope, boom, there is no heart sound. When we proceed to do Doppler, there is no heart sound of the fetus. And if we proceed to do the last one, that is abdominal obstetric ultrasound or scan, then the scan revealed UFD, dead intrauterine, mtoto amekufa in Kiswahili. It is very, very tormenting, and this is coupled with psychological torture, and even the ultrasonographer should not even tell you that you have intrauterine fetal demise, because the is he or she is doing, she will not take time to take you through counseling. Of course, when we have done our fetoscope and Doppler and also send you to ultrasound, we tell you the probabilities. Madam, now that we are not feeling, you've started not feeling the movement of the child. And also now that we've done Doppler and we've also done fetoscope, and it has been confirmed with my colleague that there is now fetal heart. So we are preparing you psychologically. We are telling you that you expect sometimes we might be making a diagnosis of intrauterine fetal demise, that the child is dead in your uterus. If we find that the child is alive, sometimes the movement can be very slow, and fetus, you cannot even able to count the fetal heart rate with your fetal scope or even Doppler, but ultrasound might peak. So we start intervening from that, and we initiate fluids, we do complete blood count, we try to find whether there's infection, anything that might result into this. But when there is confirmed that fetus is dead, now we do what we call Bishop score. Bishop score, we check whether your cervix is good, trying to use normal layman's language so that people understand. We do with our fingers to check whether there is no pelvic bones protruding, particularly if it's a mother who had not delivered for the first time. We also check whether you had some cesarean section before we do induction. Of course, there are drugs that we will give the mother the tongue and also the posterior fornix of the uterus to induce labor. So this woman will just deliver normally. If there is no problem with the pelvis, she will deliver normally, and the only thing is that the fetus is dead. Sometimes they come late. We find a fetus which is macerated, meaning in normal layman's language, it has started changing its skin color. It is becoming necrotic, inaanza kuoza. So when we find this, we initiate antibiotics very fast, because this woman is very, very busy with the uterus. Is very busy with the uterus. Next time she will come back pregnant again. So we don't want to leave this woman to go like that, because if anything happens to the uterus, then implantation will not take place. And now we will be tackling what we call infertility in women. And this one, if she has delivered the first one, we can call this now secondary infertility. I had talked about infertility in details. Kindly, in my channel, check infertility in women, infertility in men, and how we can manage. There are three videos. There are three videos of infertility. One live and 2 normal videos. So reduced fetal movements in the utero is very, very important, and it's a danger sign that each and every woman who is pregnant should know. Of course, if there's fetal movement but reduced, we give you what we call fetal kick chart, and we advise for bed rest. So fetal kick chart is you will have your time and your pen. When you feel fetal movement, you take and you write your time. When you feel fetal movement, you take and you write, and we give you, maybe we want you to do this for a period of 1 hour or a period of 2 hours to see. If we see that there's 10 kicks in 1 hour, then that is okay. We do what we call reassurance. We are reassure you that the fetus had the fetal heart, or and what we had done earlier with the fetoscope, or we are sure that the baby is okay. So in an hour, if it is 1 kick in, they are happy in the use. They can play in some women normally come to the hospital that they fetal in excess, and if there is no any sign depicting fetal distress, then our fetus is safe, and we reassure the mother. Convulsions, fits, language, if sleep epileptic patient, the way they behave when having an attack, that is typical of convulsion. A normal pregnant woman should not convulse. And if a woman is convulsing, we must find out why the woman is developing fits or convulsion or even focal neurological disorder. Just one hand can be just like these are focal neurological disorders, can be just like not shivering, but having focal neurological disorders and fits. But now convulsions that goes like this, and associated with uh, giving life to another human being. Okay. I like this, your comment, Akol. This is very, very nice. So when a mother is convulsing, this is a very, very serious. Convulsions can be due to one, we normally think of hypertension in pregnancy before even we think of malaria. So when a mother is convulsing, we might, the very number one thing, if it's not epileptic or having any history of accident affecting the spinal cord column and the brain, maybe resulting in epilepsy, we must first think of eclampsia, that is hypertension in pregnancy, and I've talked about this at the beginning. We will correlate this with the urine samples to check for protein, and we correlate this with signs and symptoms, puffy face, lower limb swelling. Initiate this particular woman on drug, that is magnesium. Now, to converse, and number 2 in the list is malaria. Then other causes like infection, and we tie this whether there is fever or no fever. And then we investigate. Of course, we'll do your sugars, we'll do your urine, we'll do malarial parasites, blood cells for malarial parasite, we'll do complete blood count, and we are interested in lymphocytes level, white blood cells. So if white blood cells are elevated, this is now conversions due to infection, and we'll start intravenous antibiotics straight away without wasting time, because conversions will interfere with growth and development of the baby, even the mental, very serious. Pregnant mother conversing, pressure, think of that is normal. Think of hypertension in pregnancy and do urinary fast. If he's not able to pass urine, there's a way you can extract this urine by catheterizing this woman and extracting this urine, taking the lab very fast as you initiate drugs for conversion, as you wait for the result. It's very, very important. And maternal death is always very, very tricky. And if a mother who came to the hospital walking and going back home while there is a corpse is tantamount to discussion. In fact, we normally check whether was any delay. Delay can be laboring 10 hours ago, reaching the hospital at this particular hour. Or this mother started conversing in the ward, what did we do as medics to save the life of this mother? So in each and every pregnant woman, we are normally happy when we discharge them, when they are having their children, or when they are with their twins and they are going home happy. But it is very, very sad for those who normally come with intrauterine fetal demise, the death of the fetus in utero, maybe they have come late, or there are some inevitable scenarios due to complications of pregnancy, and those ones we cannot sometimes avoid. Fever, I've talked about fever that in all the severe headache, I talked about fever, and fever is cutting across. This is now central nervous system. Fever is cutting across. A woman might develop fever because of infection, malaria, pelvic inflammatory diseases, all those that I've talked about. Fever must come in. And if a pregnant woman has developed fever, we start with commonly common things, malaria, pelvic inflammatory diseases, and we screen in terms of doing urinalysis to look for any infection, or even how the woman is presenting. Is there any vaginal discharge? Is there any smell? Is there anything that is making this particular woman to have even typhoid, tuberculosis, even HIV? Not forgetting HIV. Uh, when she has not been adhering to the drugs very well, develop what we call cryptococcal meningitis. Even cryptococcal meningitis can be a contributory factor convulsions that we have just talked about. Meningitis is also a contributory factor to convulsions. So we'll investigate this particular mother wholesomely to verify where is it originating, and then we'll take care of this fever in terms of managing the specific cause of that fever. The only problem that normally arise with us, with our mothers, is that they develop fever at home, take paracetamol, fever subsides, they just sit there or do their normal call. Headache sets in, fever arises, take paracetamol, headache subsides, they do their normal chores. Now, when now the body cannot tolerate what he has been taking of paracetamol, now it exacerbates, and this whereby if the patient had malaria or hypertension, convulsions normally arise, and this is very, very dangerous. Now, we normally advise that if you are a pregnant mother, or not even pregnant, if you have fever, whether you are a man, for the sake of this discussion, or any other person, please come to the hospital to investigate why is this fever arising. Paleness. Paleness is, how do we check? Pale is just level has reduced and this patient has anemia. Of course, we'll check about the tongue. We'll check about the conjunctiva. We'll check about the palm to see whether there is any paleness. And in terms of this, I talked about preventive services, and we talked about folic acid and ferrous sulfate. Our mothers who are pregnant, please. Long time ago, I said in season 2, we used to give you ferrous sulfate candle, folic acid candle, and we noticed that ferrous sulfate has metallic taste and has nausea, brings nausea and vomiting, and you are not taking. Now we are giving you IFAS, combination of the both of the two in one, which has less side effects. And I talked about the schedules that we normally give and the number of tablets that we normally give, just to brush over that for the sake of this video. We started by saying that all the medication that we normally give, we start at 16 weeks of pregnancy, and we encourage all mothers who are pregnant, please usikuje hospitali mwezi 7, mwezi 8. Sometimes I normally joke with some if I meet them when they bring their children, umeanza clinic, ni daktari bado mimba ni kidogo, and mimba is past 20 weeks going to 25 weeks. And as you know very well, those folic acid and ferrous are very important in building blood. We said that at 16 weeks, we will give you 90 tablets. At the second visit, at 28 weeks, we'll give you 90 tablets. At third visit, that is 32 weeks, we'll give you 60 tablets. And fourth visit, that is 36 weeks, we'll give you 30 tablets. So those are scheduled. And we insisted that a pregnant mother should visit, encourage, if you see or meet a pregnant mother, let them come to the clinic. Of course, everything we do for free, because government has done a very wonderful job for you by introducing what we call Linda Mama. This is National Hospital Insurance Fund, NHIF. In terms of Linda Mama, every pregnant woman has a right to receive this particular insurance, and it is free, normally helping you immediately you are pregnant up to 90 days post-delivery, that is 3 months. And we do not know why some normally come late. At 8 months is when a woman, a pregnant mother, is being given this book for the first time, meaning he has missed folic acid at 16 weeks, he has missed at 28 weeks, and even at 36 weeks. He's going to 37 weeks is when he's starting clinic. So we encourage all mothers that it is very, very key, and it is very, very important to attend clinic because of these particular danger signs that we are talking about. I know sometimes you forget to swallow the pill, and they normally confess, daktari nilisahau. Yes, we have what we call adherence counseling, and we normally tell you, if you can't remember, please, mostly almost by investigation or not the research which was done, almost each and every home they have a phone, and that phone has an alarm. Please put this alarm on so that it will remind you that this is now the time I'm supposed to take my folic acid and ferrous sulfate. But we normally insist on swallowing SP sulfadoxine pyrimethamine, that tablet you normally, the tablets, there are sometimes 3, you're normally given in the clinic to swallow. We give you right there and you swallow that. And of course, we'll give you a net to prevent malaria. Now, we have talked about fever. Breaking of water, that is a normal layman language. That is when the membrane has ruptured, and that is breakage, the amniotic fluid spills. This is very dangerous, and it is called premature rupture of membrane. And if you have noticed that you are pregnant and there is a gush of fluid towards your thigh, towards your gastrocnemius legs, please do it at home. You might be having what we call premature rupture of membrane or preterm premature rupture of membrane. If membrane has been broken, sometimes it depends. If it is due to infection, kuna kashimo kidogo imebreak and the fluid is leaking. And when we give antibiotics and bed rest and we increase fluid intake, this problem goes out. And if it is the one gushing up to the lower limb, will ensure that that breakage has not interfered with the fetus. And if it has interfered with the fetus in terms of now the fetus has matured very well, we can take you for emergency cesarean section and place the baby in incubator. And we observe this baby until the baby will mature very, very well to be able to go on. So what causes this premature rupture of membrane? Mostly they are infection. That's why we insist we do urinalysis. And if you are presenting with even vaginal candidiasis, this whitish discharge that are thick, that is vaginal candidiasis, or discharge that is light, that is bacterial vaginosis, or anything that you feel is not normal in your vagina. You can even have trichomona vaginalis in your system. You can have pelvic inflammatory disease. We do urinalysis or culture and sensitivity, and we give you the correct treatment. Culture and sensitivity may take 3-4 days. But now, thank you so much, Lady B Variety, for having been with me. I hope you've learned something, and do share with your fellow colleagues. Now, we will give you a necessary treat, and will treat you, will give you necessary antibiotics, which are also safe in pregnancy. And I want to say this to our women. Those normally go and buy doxycycline, doxy, when they have stomach problem. Please avoid that drug. That drug is toxic to the child. It is in pregnancy category D, which means that you should not touch it at all. You should not swallow it. If you have abdominal pain, please come to the hospital for an investigation. Do not just go by. We normally lose pregnancies because of somebody has swallowed a drug that he was not supposed to swallow. Are we together? Now, premature rupture of membrane, we will treat you accordingly and we will help you. Getting tired easily is also a danger sign, and it may be a sign of any disease, either malaria, either preeclampsia, either now. The common one is when you are anemic, the body needs a lot. So the energy that the heart needs to pump blood, it's too much. Even you can develop what we call congestive cardiac failure because of simple anemia that you had. So it is very, very important to come to the hospital if you feel tired and you are pregnant. There's tiredness when you've worked, you feel tired. After resting, the tiredness goes away. But if you have persistent tiredness, or you are getting tired easy, you cannot even climb a hill, kindly come to the hospital for more investigations. Breathlessness. If you develop breathlessness, your difficulty in breathing can be due to anemia, also can be due to pneumonia. We will investigate further and check why you have breathlessness, why you have difficulty in breathing. We'll even rule out if you are asthmatic or no, other diseases affecting people through childhood up to adult, like sickle cell disease. We'll screen you from cardiac disorders or kidney problems, to find even liver problems, to find out the possible cause of you not breathing well. Now, in all these danger signs, we normally say that you should be having what we talked about in further support. That thank you so much and welcome. Accord TV, can you share the link? I'm almost clearing the danger signs, and I'm talking about danger signs. Sometimes I'm talking about management. Now, and if you come to the facility, there is something that we normally give you to sign. And in signage, it is very, very necessary to know for us as clinicians, as whom do you want to deliver you? Do you want to be delivered by a male or a female? And who is going to rub your back? Is it your husband, or the nurse will do it for you? Whom do you want to accompany you? Who do you want to be by your side when you are delivering? Who do you want to witness? Because these are in the birth plan. We are, even if you are at home, do you have our numbers? Do you have the hospital ambulance number? Do you have the driver ambulance, or do you have the hospital number per se? Because the driver's number can be off, but the ambulance is in the facility, and the person charged with the phone will automatically direct the call or go personally where the ambulance driver is and pick you and bring you. In cases of emergency, we have in where I'm practices of Mabay County Referral Hospital, we have standby ambulances for emergencies, and all the sub-counties that are surrounding Homa Bay County, like Kandiege has an ambulance, like Dewa has an ambulance. Ambulances are distributed all over the county. So if you, wherever you are in Homa Bay County, even if you call, they will respond very, very fast. And we don't want a scenario that you will start expensive labor and you are keeping quiet. Some normally reach in the hospital and they deliver on the floor even before reaching the maternity ward. And this one poses great dangers to our children, to our newborns. So I want you people, if you have, if you are a preemie and you do not know when, how labor is, if you feel any pain, please report to the hospital. We verify, is this one labor or this is a false labor, Braxton Hicks that I was talking about, so that we can know how to manage you. Now, when I'm going on with the birth plan and where to deliver, the transport I've talked about, talking, we normally come with our wives, but we also do kind of labor thing, something to keep the baby warm. Please, let's plan this early enough. Our women can forget, but as men, when we've taken this responsibility, I talked about this in the father support, that if you take this responsibility of being with our wives and see what is happening into the maternity, we'll be able to provide every necessary items. A mother has delivered, she has gone through cesarean section, post-delivery, there's nobody around her. With that intense pain, there's nothing to eat. In fact, this one I witnessed when my wife went to deliver. I was with her from 0 hours to delivery time. And there's a lady who went for cesarean section. Nobody was with her. But tulimwonea huruma, we gave her some food, we gave her some our baby clothes, we gave her some our baby oil, and also we shared together, we laughed, because she was developing what we call postpartum blues or postpartum psychosis. They normally deny their child after delivery. They don't want to see that child because there's nobody giving them mental help, psychological, physical, mental, even Christian help. No one. So I'm encouraging our people out there in the community. If your spouse, if your wife has come for delivery, perhaps you are working very, very far, kindly send somebody to accompany her, because sometimes there might be something that we need as clinicians. You know, post-corona crisis is everywhere in the hospital. Some things can miss. We may want this and this one is not there. And now whom to send? And of course, those things are not there. You buy them from outside and there's nobody to send. So if a woman is coming to the hospital, kindly let somebody accompany this particular woman, so that in any case, we want even the lassos, the wrappers, the baby clothes, there's somebody who can come and pick those things to bring to us. Sometimes you go to somebody's porch, to look at what you want, and you meet the unexpected. Some have even met snakes, and this is true, I'm not lying. In where I practice, somebody brought a snake in the bag. I don't know how the case ended, and I don't know what was the function of the snake, or to appease the gods that the baby has been born, and now everybody has their gods. So, in summary, we are ending this in 3 minutes time. We've talked about care during pregnancy, and we've said that eat one extra meal every day during pregnancy, eat plenty of fruits and vegetable, drink at least 8 glasses of water, take iron and folic acid, avoid heavy work and rest very well, sleep under long-lasting insecticide-treated net, and go for antenatal care at least 4 times, at least 4 times. Also, we've discussed about danger signs during pregnancy. Of course, we've talked about these signs. If you feel them, kindly visit the nearest health facility in terms of severe headache, vaginal bleeding, severe abdominal pain, reduced movement of the fetus, convulsions, fever. Yes, Irene Zab, we've talked about very, very many things, and we are concluding about the danger signs or during pregnancy. And we also talked about if you noticed breaking of water, getting tired easily, swelling of the face and hands, breathlessness, this one you should be coming to the hospital, and always have what we call birth plan. Birth plan that we have talked about, where to deliver, transport to the facility, by saving some money for baby items, for your wife items. And it is very, very sad that some normally come even without maternity dress, and they are putting on tight long trousers. They are giving fetus distress that the fetus should not have. Some money we've talked about, and also we've talked about this birth plan. You should be preparing in advance. This episode is episode 4, and I'm very happy that if you have continued watching this episode right from episode 1, that is further support during pregnancy and post-delivery, and also antenatal profile that we've talked about, and preventive services that we offer during delivery. Now, in our next coming video, we've nurtured this kind of woman. We've prepared her psychologically. The woman is in labor, and now she has known about danger signs, and of course, this our woman has delivered very, very well. So we'll talk about complications that may arise after delivery, and also we'll talk about good positioning and breastfeeding, and even care of the mother and the baby after birth, and what you should do in case you feel some signs and symptoms after delivery. Then we will brush about postnatal care, and in the episodes to come, we'll talk about child welfare, even the screening of cancers. And this screening of cancers, I'm going to do a video particularly on human papilloma virus that we now encourage from 10 years. You should be coming to the hospital for investigations and screening, and maybe we are giving 10-year-old ladies, both HIV positive and negative, the human papilloma vaccine. Kindly share this. I will make a video on human papilloma virus, full one, which is well understood with a very, very simple words that you will be hearing. But there are some words that will be very, very difficult, like Papa Nicolau, Papa Nicolau, Papa Nicolau. but you know very well pap smear, you've heard about that. So we'll be talking about the VI villi. Those are terms that I will make simple in terms of screening of this particular woman, to do with breast screening and even cervical screening to prevent this cervical cancer. Otherwise, thank you so much for this wonderful hour. For those who have been with me, those who will continue watching this video, kindly, the red button written subscribe, hit that bell, hit that button written subscribe, the red one, until it turns black. Turn on notification bell until it says glung, 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 for more videos that I will post. I'm ending this, and thank you so much for being with me, and may God bless you, and we continue with this discussion of focused antenatal care and advise all our mothers to take Linda Mama. Let them take Linda Mama and let them have this booklet duly filled. And when the child will be an adult, I told you during the first introduction that you should be handing over this book to your daughter or your son when he is an adult. Otherwise, thank you so much. Muchas gracias. Ending it now. Ending it now. Ending. Are you sure you want to stop?